So I guess the first thing to say is that it's a little bit different to what it used to be, in that they probably won't come here initially. So whereby you used to come and maybe speak to reception in person to book an appointment and then have a face-to-face appointment with the GP. Now the situation will be more dealt with on the phone. So patients will ring in, reception will ask them what the problem is, so that they can direct them to the most appropriate person. If it's a doctor type problem, then they'll be booked a phone call with the doctor, and that'll either be routinely, so that could be within the next week or two, depending on the availability, or if it's more urgent than that, it will be dealt with on the day, but the patient will get a telephone call back from the doctor who will discuss the problem with them and then work out the most appropriate thing to do. If that involves needing a face-to-face examination, then of course the patient will come in and see the doctor face-to-face, but it may be that we can deal with that on the phone. It may be that we can do some tests and then follow up on the phone. But we'll do the most appropriate thing for the patient, but it will be dealt with on the telephone first.
So you would ring reception, they'll ask you what the problem might be, and the receptionist should be able to make sure that you see the right person in the primary care team in the surgery. So if it's a doctor problem, you'll be directed to the doctor, nursing problem, nurse or nurse practitioner. So you know it's a full team that we have there waiting for patients, whatever the problem. I would probably add to what Tim has said. So, you know, when patients come to the surgery, if they need a face-to-face appointment, certainly at my surgery, they'll be greeted at the front door by receptionists who will take their temperature and who will give them some alcohol gel before, you know, inviting them into our waiting room. And all our patients we ask to wear a face covering when they come to the surgery.
Yeah, so it's not exactly the same, and I think that's probably the flavour around the county, that everybody does the same thing slightly differently. We're really not using the waiting room very much. Patients are waiting in their cars, and then provided they drive, they'll wait in their cars. We'll call them at their appointment time and invite them to come in, and then we'll meet them. We'll meet them in the waiting room or invite them straight through to our room if they know where that is. And there is alcohol gel available at the front door for them to use.